The pulp response to crown preparation and cementation by Devon 2023 in Tufts University. This study aimed to determine the incidence of pulpal disease after the placement of either full coverage crowns or large non-crown restoration and to evaluate the factors that might increase the risk of complication after the placement of such restorations. Available radiographs was conducted to confirm that teeth with history of pulpal disease or endodontic treatment before restoration placement were excluded to ensure that there was adequate time for clinical or radiographic signs of pulpal disease to become apparent. The minimum recall time was 1 year. The overall sample size was 2,177, 1,779 with non-crown, and 398 with crowns. Over the course of this study, 8.7% of the patients who received any large restoration developed pulp disease. More specifically, 7.54% of patients who received crown and 9% of patients who received large non-crown restoration eventually required a further treatment. These rates fall into the range of what previous studies have reported, which range from 5 to 16% of chance of exhibiting pulpal pathosis within the 10-year of crown placement. Also, in the present investigation, the risk of developing pulp disease was 22% lower in the 3-surface group than the 4-surface group, which is most probably due to that a large restoration can be associated with less remaining dentinal thickness, less structure support, and more microleakage than full coverage crowns, all of which may contribute to the observed increase in pulpal disease. Within the non-crown group, the odds of developing pulpal disease were 32% higher in amalgam, which could be due to increase in the preparation size that is required to achieve mechanical retention. And of the patients who developed pulpal disease after large restoration placement, approximately 43% of them were treated endodontically and 56% were extracted. In this study, it was found there was a statistical significance associated between increased age and the occurrence of pulp disease after large restoration placement. More specifically, for each additional year of age, the risk of pulpal disease increased approximately 1%. As suggested by Abu Ras, it may be that over the time, the cumulative effect of daily use, including poor functional habit, chronic caries disease, or restorative procedure, leave the aged pulp less able to recover from pathologic and trauma. And in this study, the type of crown restoration, tooth location, patient gender was not found not to have any impact on the rate of pulpal disease. This is with the limitation of retrospective studies.